So as primary health networks or PHNs across Australia, we've been given the activity by the Commonwealth Government to start to redefine a step model of care for our regions. And whilst every region will do it differently, it's a really important process in making sure that from low intensity services through to the more acute and complex services, people are receiving a wraparound coordinated system to support them as they travel across it or as they duck in and out of it and receive care at any one point in time. For North West Melbourne PHN, having people at the centre of their care is really integral to our model, and what we've created is a system of care. So it's a wraparound model that is really clearly articulated in a nice visual where you can see the person, their families and supports at the centre of that model. So what that actually means is that the person themselves, in collaboration with their supports, is making decisions about how and when they receive care. It's giving them back the power and making them an active advocate for change in their world. The service system's been very much funded historically to be funding services to change and drive change in the setting. So now we're saying consumers need to be consulted, consumers need to be part of the referral pathway. They as patients and people within the system need to be able to ask when they're not getting what they need from a service system, and that should be okay.
Isolating, frustrating, lack of communication, because no one is connecting, no one is communicating. The doctors and the whole health system is not, they're just not communicating. Nobody knows what's going on here, nobody knows what's going on there, so they're not interacting with each other. That's probably the best way to say it.
Basically, I think it'll be access. I think the community will be able to access support much quicker and much easier as opposed to the previous systems. So patient-centred care is that focus about being able to inform the client, them making the informed decisions, and also their care team around them being accessible. Mental health literacy for the community as a whole, I think, is quite low, and I think it's even lower in terms of cold communities where that education's just not been there. The translation has been effective to some extent, but it needs more support and it needs more drive in terms of getting the message out there and helping those type of communities better understand what mental health means and what good mental health means.
I find that with the system at the moment, the funding goes to the organisations and hopefully it's a fit for people. And I find that there's not the money that it's there for, the actual people with mental health don't get much of that money actually for them, for programs and even subsidised programs or whatever it may be. It shouldn't be about the organisations, it should be about, number one, the person with mental health, that lived experience. For me, with even the last 2 years, like I've had to defer from uni a couple of times because I haven't been travelling well. So to have a support system there, whether I need it, 100% or when I do need it at the time, it's there, it's not up and down. That's extremely important, and looking forward to the future, I truly am, it's worth hanging on for.